my name is Alicia Sells. As you already know, hand hygiene is the most effective way to break the cycle of infection. The Centers for Disease Control and Prevention, Joint Commission, and the Institute for Healthcare Improvement and World Health Organization all have tools and programs in place to increase education about the importance of and need of hand hygiene. In addition, these organizations have guidelines for evaluating compliance of hand hygiene and effectiveness of programs. Nevertheless, recent studies have shown that less than half of healthcare workers complete hand hygiene for various reasons. Today, I would like to talk to you about a revolutionary idea that has taken hold in the healthcare industry: the use of ultraviolet light to kill bacteria in hospitals. Research from Duke University and University of North Carolina have shown short-wave ultraviolet radiation to nearly eliminate all germs on surfaces in hospitals. In fact, some facilities have begun using ZiZo, a germ-zapping robot, to terminally clean rooms of the most dangerous pathogens. The FDA has also approved BioGuard, a self-sanitizing keyboard using ultraviolet light. In other areas, studies at Columbia University Medical Center has proven that ultraviolet light has been successful at reducing surgical infections and at the same time not harming human skin. So why not apply ultraviolet light technology to hand hygiene? Two teenagers from Hong Kong, Simon Wong and Michael Pong, have created an ultraviolet light door handle that kills germs on contact for the use of public restrooms. Developers at HMC have been hard at work to adapt this concept to the world of healthcare. I am proud to say that it has been a success. HMC is now launching ZiZo, Zap In, Zap Out, hand sanitation using UV light. ZiZo is available as a door guard or a standalone room guard. The ultraviolet light used in the door and room guard use a 207 nanometer ultraviolet light. Much research was conducted to ensure that this wavelength of light was strong enough to kill bacteria yet not damage human tissue. The 207 nanometer UV is a very narrow spectrum of light that has been proven to kill bacteria, yet is unable to penetrate the nucleus of the human at the cellular level and cannot reach the sensitive cells in the skin epidermis or the eye lens. Again, there is no damage to humans by the use of this ultraviolet light. ZiZo is designed to replace the constant hand washing for the purposes of only entering and exiting a patient's room. ZiZo is not intended to take the place of washing hands with soap and water when hands are visibly soiled. I'm confident that soon everyone will be saying, "Don't forget to ZiZo." Are you ready to see it in action? Nurses' days are very hectic. Too many patients, staff shortages, and not enough time contribute to the chaos of a 12-hour shift. Add in washing your hands about 100 times a day, and you might be able to understand why nurses sometimes forget or skip washing their hands. Other factors contribute. Sanitizer bottles being empty, sinks are inconveniently located, lack of soap or paper towels, hand washing causing irritation and dryness, and inability to apply gloves after applying sanitizer.
There's got to be a better way.
HMC kept all this in mind when designing ZiZo, Zap In, Zap Out. HMC has created two different products to satisfy different facility needs. The ZiZo Door Guard, when activated, eliminates germs on hands before entering the room, preventing the spread of infection. All you have to do is hold your hands for 5 seconds on the surface. Our other product, the ZiZo Room Guard, can be placed on any flat surface for increased versatility. Simply insert hands for 5 seconds inside the product to eliminate germs. HMC is prepared to sell this revolutionary product at $50 for the ZiZo Room Guard and $100 for the ZiZo door guard. While the initial cost for each hospital is considerable, you have to think about the amount of money saved. The Centers for Disease Control and Prevention state that the annual direct hospital cost of treating healthcare-associated infections in the United States is between $35.7 billion to $45 billion. And it's all preventable. HMC has a timeline in place to equip every hospital with a ZiZo by 2020. We plan to divide the country into 4 sections. The Northeast will be completed by the end of 2016, the Southeast by 2017, Southwest by 2018, and Northwest by 2019. It is our overall goal to assist the National Action Plan to Prevent Healthcare-Associated Infections Roadmap to Elimination's 2020 goals. Thank you for your time and attention, and don't forget to ZiZo!